Hello, good afternoon. Thank you for joining me for this update on COVID-19. I appreciate everyone in the local media for keeping everyone in Jacksonville informed when we provide these important updates. On the call today is Emergency Operations Director Steve Woodard, who will be available to take questions with me at the conclusion of this briefing. The latest data from the Florida Department of Health has 69 new COVID-19 cases in Duval County, 254 deaths, and an overall cumulative positive testing percentage of 11.2%. Our daily percent positive tests in Duval County today are 6.18%. I'm continue to be in regular contact, formal and informally, with hospital leaders. They continue to be cautiously optimistic of our current trends. There are 224 current COVID-related hospitalizations in our city and our county, and all are reporting available capacity. Our numbers continue to move in the right direction, and that is good news, but we have to remember to be vigilant and continue to be aware and take the necessary steps to slow the spread and get this under control as we wait for a vaccine. I'm grateful to everyone who's done their part, wearing masks, social distancing, stepping up their sanitation practices. We've just got to keep it up and stay the course and not get comfortable as these numbers have recently declined. As long as the virus is with us, the possibility of community spread remains. So let's do what we can to reduce the opportunity for the virus to spread. We can do this together. The day before classes resumed in Duval County, Dr. Diana Green joined me to talk about reopening of schools in a time of COVID-19. The very next day, Dr. Green was in the classroom as a guest teacher, leading from the front. I want to thank her and her amazing team and the board at Duval County Public Schools for their efforts to get our kids back to school safely. As an update to an announcement we made in that news conference in regards to free and rapid testing for Duval County Public School employees, today I'm announcing the expansion of that testing to include students, to ensure all Duval County public, which includes public charter schools and private school students, have the opportunity for faster COVID-19 testing when needed. My team and I are working with Logistics Health, one of our city-sponsored COVID-19 test providers, to establish a student express lane at 4 different sites. And again, this will be available to all students in our city. Traditional public schools, public charter schools, and private schools. The student express lanes are located at the Ocean Way Senior Center, Lane Wiley Senior Center, Leroy D. Clemens Senior Center, and Mandarin Senior Center. These lanes will be open Monday through Friday from 11 a.m. to 7 p.m. Students must have a verification letter from their school, and their parent or guardian must accompany them to provide consent for the test. My team will distribute a news release with more information about the testing process following this briefing. Before I move on, I want to stress to parents, students, and everyone in our city that it's up to us to continue to do our part to mitigate the spread of this virus. It's important we all take the necessary steps and act responsibly in these challenging times, working together as a community to overcome COVID-19. With that, Director Woodard and I are available for questions, and we'll start with Jim with WJXT.
Mayor, if you could just elaborate a little bit on the testing for students. Do they have to be symptomatic, or is it any student at any time? Do they need to be sent there? How is that going to work?
Well, the schools will manage that if they deem that a student needs to be tested with obviously parental consent. Maybe there was exposure. We will allow, the schools will make the decision whether or not to send if a student needs to be sent to one of these testing sites. We have capacity, we have availability. We invested heavily in testing as we promised months ago. Now this is additional access and resources for our students, in addition to our partnership for teachers a couple of weeks ago. Ann with First Coast News.
Good morning, Mayor. Could you talk a little bit about cost, and when you say rapid, how rapid, and whether the school systems in any circumstance would make these mandatory? for students?
The test turnaround times at these city sites are typically about 2 days. And these sites are city sponsored, so there's no cost associated with the test for the individual being tested. I think the last part of your question was about being mandated. I'm not going to mandate anyone be tested. I don't foresee that happening. I think that is a personal decision. But I would say if someone knows they've been exposed or they have symptoms, they ought to be tested and they ought to be isolating. Megan with Action News.
3 questions here, Mayor. What was your exact decision behind adding this testing? Should a student quarantine after they get their test? And if they do miss school because they're getting a test or they're quarantining, will that count as an absence? My last question to you is that the school district has announced that more than 5,000 students are absent from schools, both brick and mortar and virtually. Is that concerning to you at all?
First, I would say the decision point is fluid situation. Look, a couple of weeks ago, working with Dr. Green and Councilwoman Brenda Priestley Jackson, who brought the idea, frankly, to the city, to me, about providing testing for teachers, rapid testing. We made that investment with the schools. And as we got back into school, I looked at our testing sites and our availability and recognized that we have the ability with resources we have now to provide this opportunity for students should they need it. In terms of quarantining, the schools have laid out those protocols and they'd be the ones with the knowledge in the classroom in terms of who was in the class, did someone test positive, who was exposed. They then already have protocols in place about those kids going home, being quarantined and not being in school for a period of time. And those would apply as well, I would expect, if someone goes to get a test. If someone ends up getting a test, just a hypothetical, say a student gets a test just because somehow they do that, and it's not because of any exposure, you wouldn't expect any sort of quarantine at that time. I don't think that would be reasonable. I don't know the school policies on absences, but I do know that they're navigating this responsibly. They're on top of this every day. I have two of my daughters are in public schools right now, and they're navigating that as well. In terms of students being absent, that's a part of what we're navigating right now. And it's interesting. I've heard just the new era of COVID. I think of the own experience I'm hearing from my kids. So when my kids were in elementary school, it was a big deal to win an award for not missing a day of school, never being absent. It was a big deal for also missing, just a few days of school. The messaging, and that was a different era. We weren't dealing with COVID-19. The messaging coming out of our schools now that my kids are bringing home is they're saying to kids, don't focus on this not being absent as a badge of honor. We have to be responsibly, and if you have any symptoms that day, you shouldn't send your kids to school. Sky with WJCT.
Hey, Mayor. I wanted to follow up on a previous question that Megan asked, and that was, we have a lot of students, I want to say close to 6,000 that are currently that haven't shown up to Duval homeroom or brick and mortar. So if you could just comment on that. A couple other things that I wanted to ask about was, do you have any idea how active the testing was for teachers in these first couple weeks as things got open and you guys made that partnership with the Duval County School District? And my last question is regarding that verification letter. So if a student wants to just get tested just because, you kind of touched on it before, is that possible for them, or is this only going to be dictated by the school when they see exposure? Thank you.
Yeah, we are making testing available to people that aren't symptomatic. They would just need a parent verification as well. So I would advise people, unless they have a reason to believe that there's been an exposure, if they're not symptomatic, get a test if you think you need it for a specific reason. And our schools, again, will navigate some of this as they know who's been exposed. As it relates to, and now that you've restated the first part of the question, I misunderstood that. Now I get it. 5,000 to 6,000 students that are basically unaccounted for. Obviously, that's a concern. I would just get the message out to parents, to guardians. Find a way to get your kid back. If you're not comfortable with brick and mortar, take the virtual option. Our young people in our city need exposure to learning, so let's get back to school. It's obviously very, very, as a parent myself, I'd say that's very concerning. Emily with the Times Union.
Hi, Mayor. The school district was told last week to pause its release of case numbers until it receives permission from the state. Do you have comments on that? And do you think the public should have access to those school-related case numbers?
I don't, so I haven't been engaged in the specifics of that, other than what I've seen in the news. So I know less than you know, because you're covering and following it. So I've just read about it. So I don't know the protocols or the reasoning behind the numbers as it relates to the Department of Health and our schools. So I'm not going to comment on that. I think everybody's doing the best they can in working to beat this. I will say as a parent that I personally, yes, would want to know if there are positives in the schools that my kids are at, was there exposure? So to the extent that we can have transparency as parents and access to numbers, I would expect that. But I want to be clear, I don't understand the protocols and the reasoning behind that development last week. So I don't want to assume that anyone is intentionally withholding information, nor be on the record saying that, because I just don't know that to be the case. I would just encourage, let's get parents the information they need as timely as we can. Thank you. No additional questions. Again, I appreciate everybody's time, and let's all do everything we can to be safe.